Understanding the interplay between physiology and other sciences like genetics and anatomy is vital for a thorough medical education. This interdisciplinary approach deepens our clinical insight into health. The classification of physiology into general and systemic branches facilitates the study of health and disease. This distinction aids in comprehending the normal functions and pathological changes of organs. General pathology is critical for differentiating health from disease, focusing particularly on the social dimensions of illnesses. It underlines the importance of prevention and the factors shaping individual health. Physical factors such as kinetic energy, extreme temperatures, and radiation can negatively impact health. Grasping these elements is essential for effectively managing health risks. Chemical factors include exposure to various harmful substances like cadmium and nicotine, which may lead to significant health issues. Recognizing these chemicals is key to prevention and health maintenance. Biological factors pertain to the effects of microorganisms and toxins, which can trigger infections. Identifying these biological influences is crucial for disease prevention and treatment. Resistance mechanisms in organisms profoundly affect how they respond to treatments. Understanding these mechanisms aids in evaluating the efficacy of various medical interventions. Pathogenetic therapy, a common treatment method, shapes the course of diseases. It encompasses diverse strategies aimed at modifying disease progression. Oxidative stress plays a critical role in disease development. Active oxygen radicals can inflict considerable cellular damage, increasing susceptibility to various diseases. The simplex cycle illustrates how decreases in blood pressure can influence heart dynamics. Understanding this cycle is vital for interpreting cardiovascular responses to stress. Lipid oxidation significantly contributes to cellular damage. This process can lead to serious heart health complications, underscoring the need for effective lipid management. Compensatory mechanisms enable the body to recover from the effects of diseases. These adaptations are crucial for maintaining homeostasis amidst environmental changes and stresses. Homeostasis is essential for health, involving meticulous regulation of the internal environment to uphold stability despite external fluctuations. This balance is fundamental to an organism's overall well-being. Diseases disrupt normal bodily functions, often presenting through specific symptoms that reflect a reduced ability to adapt. This disruption can lead to decreased social utility. The classification of health and diseases encompasses various factors, including age, sex, and ecological elements. These classifications enhance our understanding of the mechanisms underlying health conditions. Disease classification covers both communicable and non-communicable diseases, each with distinct traits and treatment approaches. This classification fosters improved healthcare management. Symptoms of diseases can vary widely, often appearing vague in the initial stages, complicating diagnosis. Recognizing these symptoms is crucial for timely medical intervention. Duration plays a key role in understanding disease progression, with incubation, manifestation, and outcomes influencing treatment decisions. These insights are invaluable for healthcare professionals. Non-communicable diseases can lead to severe complications, such as cardiovascular problems, highlighting the importance of early identification and management. These complications greatly impact patient health outcomes. Achieving complete recovery from diseases requires restoring both function and structure, emphasizing the necessity of effective treatment options. Favorable outcomes are possible with diligent monitoring and intervention. Remission can be followed by disease recurrence, underscoring the need for continuous management to ensure patient wellness. Understanding the transition to chronic forms aids in developing better treatment strategies. The pregon and agon stages are marked by significant physiological changes, such as hallucinations and hypotension, indicating severe distress. These conditions necessitate immediate medical attention. The reversibility of the clinical state is vital, providing potential for reanimation within specific time limits. Timely medical interventions can significantly influence patient outcomes. Pathological reactions in organisms are often abnormal responses to ecological factors, leading to conditions like inflammation and hypoxia. Understanding these reactions is crucial for devising effective treatment strategies. Pathological physiology explores the structural and functional alterations in organs due to disease, utilizing methods such as animal models and mathematical modeling for comprehensive analysis. Experiments in pathological physiology may be acute or chronic, facilitating an understanding of both short-term and long-term effects of diverse disturbances on the organism. Modern functional techniques, including ultrasound and computer tomography, serve as essential tools for examining physiological functions and diagnosing abnormalities within clinical settings.